Do we need to wait for an IV fluid bolus, a 2-liter bolus, before epidural placement? This is or was common practice on labor and delivery. And when I say that, I mean universal, everybody must get XYZ bolus before getting an epidural. For at least this commenter, it seems like it still is, but you tell me. I included this slide on a presentation I did 5 years ago. Here I say that the ASA says not to delay spinal anesthesia, not epidural analgesia, which is far less likely to cause hypotension, in order to administer a fixed bolus of IV fluid. I mentioned 2016 guidelines because this was before a 2022 statement by the ASA, which again noted no need to delay spinal anesthesia for a preload of IV fluid. But they do recommend co-loading IV fluid, running a fluid bolus during the procedure, which physiologically just makes more sense if the mechanism of the hypotension is a sympathectomy, and especially they recommend the use of vasopressors. Also, patients requesting epidurals are not NPO. Of course, there's this debate about eating during labor, but I hope we're all letting our laboring patients drink. Many are drinking a lot. And this is in contrast to spinal anesthesia for C-section, where patients are much more likely to be hypovolemic. Is it a big deal if we just quote unquote play it safe and give the fluid bolus? Are we doing any harm by practicing that way? Well, of course, there's the delay of care aspect, but also giving a whole bunch of fluids to laboring patients is not benign, especially with long labors and bolus after bolus after bolus. So if everyone just does it to be safe for everything, that can add up over time. People who disagree with me are usually very afraid of hypotension after an epidural. If hypotension is that common, I think that's a problem, and these patients probably are not getting low-dose techniques.